answered. So without further ado, I want to introduce our esteemed panelist tonight, Ms. Nicole Sheppard. She is the Transitioning Youth Coordinator for the Southern Maryland Regional Office of the Developmental Disabilities Administration. So she'll be here to tell us a little bit and help us untangle the DDA web. So Nicole, please take it away.
Okay, thank you so much for that, Rob. So I am going to just give me a second. I'm going to share my screen here so you guys can see my presentation. All right, and it should be up. Rob, can you tell me if you can see that?
Yes, I can.
Okay, awesome. So as stated, good evening, everyone. I am Nicole Sheppard, and I'm the Transitioning Youth Coordinator for the Southern Maryland Regional Office with the Developmental Disabilities Administration. So tonight, I'm just going to give you guys a presentation, an overview of what DDA does, the services that we offer, how to obtain our services, and things of that nature. Because I know a lot of you have probably heard, apply for DDA, DDA, DDA. And it's like, what is DDA and what can they do for me? So without further ado, let's get started. Oh, technology, maybe not. Oh, goodness. Oh, there we go. So the Developmental Disabilities Administration, we provide funding for people with developmental disabilities. We're going to partner with people with developmental disabilities and their families to provide leadership, resources, to enable people to live their most fulfilling lives. So DDA is guided by the principle that people with developmental disabilities have the right to direct their lives and services. So what that means is a lot of times, we'll get asked, like what services do you actually provide? So DDA does not actually do the hands-on services, but we are the funding source. We are going to pay for it. So when you think of DDA, I kind of want you to think of money. We're going to pay for your loved one or anyone to go to these different providers that you know out here in Montgomery County. We are definitely guided by the principle that people with developmental disabilities have the right to direct their lives and services. So with us providing the funding for services, we want to make sure that your loved one stays at the center of that plan and that we're making sure that we're evolving and doing a plan around what your loved one wants to do. So our application process. So our application is online. At this current time, I'm sorry, you can't fill it out and turn it in online, but you can print it off online and we'll accept it by mail, fax, email, anything of that nature. So what you'd want to do is fill out the application. You want to include the supporting documentation. What we consider supporting documentation will be like the psychological, IEP, and any kind of medical documentation. It is very imperative that you keep the copies of those IEPs and the copy of the psychological and any medical documentation that either the school gives you or a medical professional gives you, because these are the documentations that we're looking at to determine whether your loved one meets our criteria or not. What happens is after let's say you fill out the application and you submit that to our office, we're going to assign that to a comprehensive assessment person. So a CA. What that means is it's going to be normally before pre-pandemic, it's an in-person interview. We can do that over the phone now or over Zoom. So what we're looking at is to just ask some different questions and to get a better understanding of your loved one. Why the comprehensive assessment is so important is because the same way someone might appear on paper may not be the same way that they present in public or in person. So we're going to take what's on documented paper from the interview, and our eligibility team is going to make that determination. So the CA is going to be completed by a coordinator of community service, and I'm going to get into what a coordinator of community service is in here in just a second. And they have 45 business days to complete that and submit that to our office. The CCS will make a recommendation, but the determination is going to be made by DDA and our eligibility team. So please note that our eligibility team in the office is going to look over everything and they'll make that determination as to whether your loved one meets our criteria or not. So what is our criteria? So according to COMAR, if you look down there at the bottom, COMAR 1022-12. So COMAR are the state regulations for Maryland. All the state agencies have one. And it kind of lays out the definitions of things and what we can and can't do as far as our services. So COMAR 1022-12 will actually show you what our eligibility criteria is. So a developmental disability is a physical or mental impairment, but not just a mental illness. It can be a combination of mental and physical impairments though. So what we're looking for is someone that has a disability that is more likely to continue forever. We're also looking for someone, it has to have had an onset before the age of 22. That is why that documentation is important, because normally the birth date is on the psychological and the IEP. So we have to make sure that it had an onset before the age of 22. Someone who would need supports or assistance to live independently, or someone who would need the support of a team to help with their services and treatment. So we're looking for someone who has to check all of these boxes. So I always tell families, I'll normally get the question, and I know probably a lot of you are asking now, well, my son or daughter or my loved one has autism, would they qualify? There is not one diagnosis out there that will guarantee you get DDA services. We have some people who are higher functioning on the autism spectrum that qualified, and then we have some people that were lower functioning on the autism spectrum that didn't qualify. It really is just going to depend on the documentation. We have to look at all of that. But I will say that they need to have a developmental disability. You can have a dual diagnosis, but someone who is strictly just diagnosed with bipolar disorder would not qualify for these services, because that's more of a mental impairment. They can have bipolar disorder and have a developmental disability as well, but you have to definitely have the combination, and a developmental disability has to be the leading factor. So that is our eligibility criteria. So how DDA works, let's say you meet all of our eligibility criteria and we say, hey, you meet our criteria. You're going to go on what we call our waiting list. And the way DDA works is we do waiting lists by priority categories, okay? So we have 3 different priority categories, and some of you who have gotten letters from us are aware of these categories. I'm gonna start at the bottom, it just works a little easier. So probably right now, 90 to 95% of the people on the waiting list are in the current request category. That's number 3. That means you need or want services, but health and safety are not immediate needs right now. Then there's a crisis prevention. That means that you are or will be in a health or safety crisis within the next year. Also, anybody who has a caregiver 65 or older automatically goes into this category as well. And then, of course, the top category is crisis resolution. That means that it's someone who is currently in a crisis or emergency situation. For example, abuse, neglect, on the verge of being homeless. So this is how DDA funds their categories. Of course, everyone in crisis resolution would have money first, and then crisis prevention, and then current request, and so on. So as of right now, DDA only has money for crisis resolution people to fund to go into services. But there is a way for a certain group of people to kind of skip that waiting list and to go into services with the Governor's Transitioning Youth Initiative. Okay, so this is a person with a developmental disability as defined by COMAR 1022-12. And these people are eligible for funding after your school eligibility. So people who are graduating and coming out and ready to go into services, this is what this Governor's Transitioning Youth Initiative was started for. It was started a while ago, and we were noticing that when people were graduating, they would go home, and if you didn't go right into services, you're kind of losing all the stuff that the school system has worked and helped you to gain. So we don't want people to lose those skills that they've already developed. So we're going to go right into services. So these are specially dedicated funds. They're reauthorized by each year by legislature. And it is very important to know that DDA is not an entitlement. So right now, if you have a loved one that is in school, you're entitled to so many things just because they have a developmental disability. Once you get into the DDA world and adult services, you have to actually qualify, and you have to show an assessed need for all services. It's not just this is what we want. It has to be an assessed need for that service. So the Governor's Transitioning Youth is a way for people who are coming out of high school to kind of skip that waiting list and go right into services, so you do not lose all those skills that you've developed while being in school and working with the school system. So that is why it's important to be here tonight and to apply for DDA and to get into these services. So I talked a little bit about the coordination of community services. So once you're with the DDA, and let's say you're eligible and you're in one of our priority categories, you will get a coordinator of community service. This is going to be your own personal case manager. They manage a caseload. They're going to assess your loved one's wants and needs post-school. They're also going to coordinate and help connect you to adult service providers. They're going to help you identify potential providers, and they're going to complete the paperwork for waiver enrollment. because these are Medicaid paid services. So your loved one is going to go on a waiver for us to pay for the services. Your CCS, your coordinator community service, we call them CCS. They're going to help develop a person-centered plan, what we call a PCP. A lot of you are probably used to an IEP, which is the individual educational plan. A PCP is something done yearly. It's similar. It just doesn't focus on educational goals. It's all the goals. So it could be education or any kind of organizational skill, anything that your loved one wants to do. The PCP is going to look at all the goals that this person has for the year. So with that, your CCS monitors the implementation of the PCP and your satisfaction with services. Because if you don't like a service, you can change. They're also going to coordinate the annual review for the PCP and update it. They're going to assist your loved one with self-advocacy efforts to ensure that your loved one remains at the center of the plan. So as I stated before, we are guided by that principle that people with developmental disabilities have the right to direct their lives. So we want to make sure that while doing all this planning with all these people on a team, that the person receiving the services stays at the center of the plan, and we're making sure that we're doing something that they want to do. Your CCS will also assist with locating and implementing generic resources in the community. We consider generic resources that are not DDA funded. So if you needed assistance applying for Social Security or Metro Access, or we have some things like funding for camp, things like that, your CCS can help you find those things as well in the community. So that is what a coordinator of community service does. In Montgomery County, this list right here is your choice of coordination agencies. As you can see here, I believe there are 7. It is your choice on who you want to work with. When we send out the letter that says that you're eligible, if you do not make a choice within 30 days, we will randomly assign one to you just to get it done. Please note that even if you pick one or we randomly assign it to you, you're not stuck with these agencies for life. If things are not going well, or maybe you're not seeing eye to eye with the coordinator, you can either switch coordinators within an agency, because these agencies have multiple coordinators, or you can let DDA know and we can switch your whole agency altogether if you'd like. It's as simple as an email. So I normally get asked the question, well, who's the best? Who should I go with? They're all mandated by DDA regulations. It just depends on who you want to work with. And if I'm not mistaken, all of these coordinators as well are like in your community. So sometimes I think parents will look at these places like websites and you see, oh, well, they're in Baltimore. That's just their headquarters. Their coordinators and stuff are in the southern area or in your county. So do not let where the actual main place is, don't let that discourage you, but still call, do your research, but you're not stuck with anybody in case, you don't like the services down the line. So what services, I'm sitting here talking about services. What services are, available? So we have meaningful day services. We have day and employment services under that. We also have self-directed services, and we have support services. And I'm going to go in and talk about each of those. So first and foremost, under meaningful day services for day, we have 3 different programs. We have day habilitation, and these are services that are intended to increase independence and develop and maintain motor skills, communication skills, personal hygiene skills, things of that nature. We also have what we call CDS, Community Development Services. And these are activities with special assistance, and they assist with developing skills and social supports necessary to gain and retain employment. So I'm going to go into employment here. Maryland is an employment first state. We are not saying that everyone has to work. We are just saying that anyone who wants to should be able to. So with career exploration, this is a time-limited service to help participants learn skills that work toward competitive integrative employment. So these are the day services. So as I'm reading these, you can kind of think of where your loved one may fit in those categories. We also have meaningful day services that are employment services. So we have employment discovery and customization. These are time-limited services to identify like a customized employment option for the participant. We also have discovery. So normally after you kind of figure out what they want to do, you can do discovery as a process to assist the participant in finding out like who they are, what they want to do, and what they have to offer. From there, we roll right into job development. Now that we've figured that out, we're going to do supports with helping you find a job, including the customized employment and self-employment, if that's something that your loved one wants to do. With that, we would hope to go into ongoing supports, hope that they would get a job. And these are various supports that you may need, that someone may need to successfully maintain their job. It really depends on the person. There are some people out there that are always going to need to have like a job coach with them. That's fine. And then we also have follow-along supports. These are just periodic supports after a participant has transitioned into their job. There are some people that just need support once they get there, and then after they kind of get a routine and everything, they don't need someone with them all day. Maybe just drop in once, twice a week, maybe a couple times a month. That's fine too. We're trying to make sure we can hit everyone in the box. Nobody should have like just a cookie cutter plan. So those are our employment services. So like I said, we got day and employment. Now, we also have support services offered. These services that you see on this page can kind of be piggybacked on with either our day or employment services. So I get a lot of times families will tell me like normally our day or supportive employment programs go from like 9 in the morning to about 3 in the afternoon. So families, if your loved one is someone who, well, they can't be by themselves, but maybe you're working, maybe you're, fighting traffic around the beltway. It's like, I'm not going to get home. I can't be there by 3 o'clock. So one of our mostly used services on here would actually be our personal support services. That is someone that could actually pick your loved one up either at the program that they're at, or meet your loved one at home, and they can work with them in the household organization, or if they pick them up from the program, maybe your loved one needs to go into the community for something. So the personal support staff would be there to drive them. So if you have a loved one, maybe they need a haircut, maybe they want to go to the store and pick up something. We're not going to pay for the actual service, but we're going to pay for the staff to be there and the transportation for them to get there. We also do environmental assessments, environmental modifications. There are sometimes people need grab bars or ramps on their home. That's something DDA can do. Vehicle modifications. So just a whole slew of things. And these, like I said, these support services are things that can be added on with the day or employment services, just to help. So as I explained those services, there might be some of you out there like, my loved one really doesn't fit in any of those boxes. I don't see them going into any of those programs. We also have what we call self-directed services. So what this is a different model from the traditional model. DDA would actually give you a budget, and you could actually build your own day. Your loved one, the participant can build their own day around them. You would hire the staff. You fire the staff, you're the employer of record. This is something that someone would do if maybe, I've seen people say, they're not really good getting up in the morning and going to a day program. Hey, it's really, if you wake them up before 11, it's a problem. That's fine. With this service, you could start your day at 11 because your staff is going to come and do whatever's in the plan, and whatever you do, that's what your staff is going to do. So this is also an option if the day and employment options do not work for you. Please look into self-directed services because you would have control over your day and what's happening during that day. So just really quickly, I always like to share an approximate timeline of someone's transition year. I am going to use the TYs from last year. So these are the people who are going to, I call them last year, but this year, actually, the people who are going to graduate in 2021, I'm going to just use them. So generally speaking, usually the summer before your transition year, so anyone who's graduating this year in 2021, we would have started last year in 2020 of visiting providers. Even though with the pandemic, a lot of them were doing phone calls, you're kind of interviewing providers via phone, Zoom, you're reviewing providers to see. What happens is we'd like for you to at least visit 4 because we'd like for you to turn in your choices to your CCS. And we say, pick your top 4, you visited these people. Why it's important to pick 4 is just because you're picking a provider does not mean that provider has to pick you. So if you don't get into your first choice, we'll go to the second, third, and so on. So in the fall, the CCS is going to turn in that choice letter. You're going to turn in that choice letter to the CCS, and your CCS is going to follow up with the provider and see if you were accepted. If not, they'll move on and they'll keep you informed of everything as it's happening. Normally around February or March, we're going to start coming out to, we're going to, your CCS will start kind of calling you, contacting you to enroll your loved one in a waiver. As I said, these are Medicaid services. So they will complete all that paperwork. They'll probably just need a few things from you. They'll complete all of that and they'll send that into our regional office so that we can get all of that submitted and sent off so that we can get that waiver approved. July 1st is going to be the earliest start date for services. So as I stated, the people who are graduating this year, we're in kind of waiver mode right now, but a lot of them are now gearing up. We've got a lot of the waivers back, so if they're approved, they're gearing up, ready to go July 1 to start those services. So this is what an approximate timeline of your transition year should look like. If you don't hit everything perfectly, I don't like to scare parents. It's okay. We have some people that haven't even looked at providers yet, and they can still get going and get into services. So even if you're not hitting everything at the exact time of this, that's why I said approximate, it's okay. You're not a big deal. We can still work with you and get you into services. So these are the different DDA waivers. So DDA has 3 different waivers that we categorize and put people into. There is the family supports waiver, and this waiver serves children birth to 21 years old. And in this waiver, you can do the various support services. So remember that sheet where I said all the various support services, the environmental assessments and the home modifications and things like that. That various support services are in that waiver. Why there are no other services in that waiver is because children birth to 21 generally are in school, so they wouldn't need like a day service or things of that nature, but the support services are there. We also have the community supports waiver. It serves children and adults, and this has meaningful day services and the employment services, and it has the support services. So it has everything the family supports waiver has, and now we're going to add those day and employment services that I discussed. And then we also have the community pathways waiver, and it serves children and adults. And this has everything the other 2 waivers have, but now we're just adding the residential services. So normally only people that need residential services are going to go into the community pathways waiver. Not sure if some of you were aware before, but now there are no caps on our waivers. They did have caps before, but now there are no caps on these waivers. So everything is just set. So what we'd like to see is when people when they meet with their coordinators, just let your coordinator know what your needs are, your assessed needs, and then we'll work with you and we'll get you into that right waiver of what you need to be in. Woo, that was a lot of information, wasn't it? So this is my information. Like I said, I'm the Transitioning Youth and the Matrix Score Coordinator. If you have any questions, please feel free to email me. Email is definitely best. I will say this, just to help me out a little bit, if you already know your CCS and you have a CCS, please contact them because they're an extension of us. But if you're someone who does not, hey, I think I applied for DDA, I'm not sure where I stand, or I don't know who my CCS is, then please feel free to contact me because with Southern, I do cover 5 counties and I would love to talk to everyone, but normally we just don't have time. So if you have your CCS, if you have a CCS, that is your first point of contact. But like I said, if you don't, or you don't know where you stand, please email me so that I can get you squared away. Okay.
All right. Thank you, Nicole. So much information. I never get tired of hearing it. We do have some questions in the chat. So I want to encourage everybody to continue to put questions in the chat box. One of the questions that came through asks, if you qualify for services and are found eligible, can you access GTYI funding at age 20?
So that's a bit, I want to say yes and no. It depends on where your birthday falls. If you are complete with there's some people, like if you have finished your school eligibility, the school says, hey, they can't come back anymore because maybe they're going to turn 21. Let's say you're going to turn 21 late August. Because school is starting, they're like, well, you're not qualified to go here. You can still start in July. That's fine. But if you qualify to go to school that next year, then that'll be your TY year. So right now, I would say this, if there's someone who's like, maybe they're going to turn 21, September 15th, that's after the start of the school year. So you're going to be a TY for the next year. So just saying, just look at it like that way. But as soon as your school eligibility is done, then you qualify for TY funding.
All right. Another question we had come through, someone asks, my daughter is 20 and approved for DDA services. And the mom has a lifelong dream to live abroad for a year. Would it be possible for her daughter to get a 1-year leave of absence from adult services? Or if they take her with them, will she lose those services and have to reapply and wait 10 to 20 years before she can access those services?
So I will say that the TY funding, I'm going to put it to you like this: the TY window, I call it a window because it opens and closes. You do your anyone who graduates, you have a year after your school eligibility to get placed. So with that being said, anyone who's graduating in 2021, they have until June 30th of 2022 to be on the waiver. If they're not, again, that window closes. So when your loved one gets on the waiver, even if you want to live abroad, I believe the COMAR regulations state you have to have at least one DDA service every 6 months. I will say that I have seen people do some creative things with providing services via Zoom, via just over the phone, things of that nature. So yes, it's possible, but you have to make sure to coordinate that just right, because if we see that she's not receiving the service, she could get kind of removed from the waiver. Yes, it can be done though. So I wouldn't take a leave of absence though. I would just get enrolled in the waiver and figure out a way to get that service every 6 months.
Yeah, and the virtual services are an option now, so you can access them from really anywhere.
Yeah.
Okay, another question. What if your child is graduating in December of 2021 and not June due to adjustments made because of the pandemic?
That is fine. So if they were originally supposed to come out in June, and we have a couple people like this, they were originally supposed to come out in June, but the school is keeping them until December, that's fine. Your loved one would just start services in December. That's okay. And we have a few people that's happening to this year.
Is the transition year the year the individual graduates from school?
The transition year, and that's a good question. The transition year is the end of the school eligibility. School states that you are able to stay in school until 21. It is every family's right. Please know this. It is your right. I've seen people at 18 or 19, they just come out with that certificate of completion. That's fine. We're still not going to start services until the eligibility for the school year is up. So if you choose to come out early, that is okay, but you will have to figure out what you're going to do in that gap period. So that's why I don't like to say just graduation. It is a school eligibility year. If you're allowed to stay there until 21, that's when we do it. But if you come out early, you'll have to figure out what to do with that gap time, however much time that may be.
Great, thank you. Next question. My son has been found to be DDA services eligible, but his priority category determination is current request, which has no funding. My health has been declining and continues to decline. I'm seeking to get DDA funding so I can get supports for my son. What is the process for getting my son into a higher priority category, and what documentation do I need?
Okay, so you would want to reach out. If your current request, then you have a CCS. You'd want to reach out to your CCS. Talk with your CCS. There is a process that we do, a priority category assessment, a PCA, that your CCS can submit to us with documentation to show why that's a need. As far as what documentation to submit, it really is going to depend on why you're saying that you need the support. So I can't say like sometimes like people who are saying, oh, they're going to be homeless, they'll give us like the eviction notice and things like that. Whatever you're saying is the reason why you need the supports, your CCS will be able to help you provide that documentation based off your reasoning. But please contact your CCS because they have the authority to kind of send that through our system so that we can look at it and see if that priority category needs to be upgraded.
That's a good segue because the next question is about a CCS. So how does a person get connected to a CCS, and are they employed by DDA?
Say that first part again.
How does a person get connected to a CCS, and are they employed at DDA?
Okay. So no, the CCS are not employed by DDA. How you get connected to a CCS is once you apply for services. If you are deemed DD, if we're saying you meet our eligibility criteria and you're put in one of those three categories, you are automatically going to get a CCS. Okay. That CCS, all these CCS agencies are contracted by DDA to provide those services. So no, they don't actually work at DDA, but their agency has a contract on file with DDA to provide the case management services for that. So the way to get one, like I said, is to apply, be eligible, and we'll put you in one of those 3 categories, and then you get CCS.
Great. Next question. I have heard that the community supports and community pathways waivers will not enroll children. Has that changed?
You said you've heard that the community supports and the community pathway. Yes, it actually, it's not that it's changed. We've always enrolled children. I just think sometimes it's a little harder for children to get into services because there are so many services that the school can do, or maybe the autism waiver. But all 3 of our waivers, community supports, community pathways, and the family supports, all service children. All 3 do service children.
Great. Next question. Our 25-year-old daughter has been approved for the middle level category of need, but there's no funding. Any inklings about funding?
As of right now, no. I don't know of any inkling. I know that we got the GTYI and the crisis. So I have not heard anything else about the other categories.
What happens to children who might already be in a waiver program, such as the autism waiver, or if they're already enrolled in the community pathways waiver?
Okay, so 2 different things. If someone is already in the autism waiver, generally what happens, I know you guys with the pandemic, things went a little different. Generally with the autism waiver, if you're graduating, normally that autism waiver shuts down on June 30th. DDA generally picks up right on 7/1 so that there's not a lapse in services. I know the autism waiver was extending some of their services due to the pandemic, and DDA, we're normally aware of that so that we know to push our waiver or something back. So if you're in the autism waiver, that is fine. You cannot be in 2 waivers at the same time. So that's why it's important, if you're in an autism waiver, to work with your CCS, to work with EDD, who does all the waivers, and DDA. We got to make sure we get it perfect and that date perfect so that we don't have a lapse. If you already have a loved one, there are some people that were maybe crisis and they were already either in, some people were in the FSW already, some people might have been in the CSW or the community pathways waiver. If you're already in one of those and maybe you were just getting personal supports, but now your loved one is graduating, your CCS is just going to update your PCP, that plan I was telling you about, to add those day services. That's fine. You just won't go through the waiver process. You'll just update your PCP to add whatever day programming, whether it's day or employment, that you like.
Great. Next question. Hi, what do we need to do if we want to go with self-directed services? My son may not be in Montgomery County Public Schools at 21, and he has a CCS from Montgomery County DHHS as a service provider. I assume that's just a CCS.
Okay. So you would just want to reach out to your CCS, even though you're already with Montgomery County DHHS, even if the person's not in a Montgomery County public school, as long as the residence is still Montgomery County or in one of the counties in Southern, that is fine. Your CCS can work with you and walk you through that entire self-directed process. You just want to let your CCS know, and then they'll talk to you about that whole process, set up a meeting so that you guys can do the PCP. Even self-directed people do a PCP to just lay that plan out and then submit it to DDA. So that's fine.
Okay. Next question. I have an 18-year-old who is homeschooled, not connected to any community services. He will remain in high school another couple of years. Do I apply now to get him in the system or wait till he is 20?
Please do not wait until he's 20. So you can apply. I want to let everybody know you can apply to DDA at any time. You really can. I've seen applications for 2-year-olds. I've seen applications for newborns. Normally, when you apply to DDA that early, though, why someone's deemed not eligible is because there's not enough paperwork or documentation, medical documentation to support that need yet. So you can apply now so that way we can get you in the system and the CCS can start working with you to start that transition. Because if you wait until 20, I know I laid out that timeline and it seems simple, but it's so much stuff happening. Your loved one's last year of school, between the school system, and now you have DDA coming and say, I need this. Do it now so that we can prepare. Please do not wait until they're 20. At the latest, I say 18, that's at the latest. But like I said, you can apply earlier than that, but definitely by 18, you should apply. So apply now, please.
Can you get the community pathways waiver even if you aren't ready to move out of your parents' home?
No, you cannot. The community pathways waiver is now strictly for people who are going to need residential services. If you need services, you can go into the community supports waiver. So I think a lot of people were last year like really caught up with the funding caps on those. There are no more funding caps on those. So whatever kind of services you need and however many you need, as long as there's an assessed need, we can do that. So the community pathways waiver is strictly for someone who's going to need residential. If they don't, if you're just looking for day services and maybe some personal supports in the home, community supports waiver supports that. So we would not put you in the community pathways waiver.
Another person asks, my son is 27 now. He's on the DDA wait list, but we weren't aware of the TY funding. He was homeschooled and has been in college ever since. Are there any options for him at this point?
As of right now, I would say look at an agency like Doors. Right now with DDA, I would say that there's not only strictly because the funding that we have right now are really for TYs and people who are in a crisis situation. So if you don't meet those criteria, there's not funding right now for DDA. So I would definitely, if you have a CCS, work with your CCS to look into there are other agencies and entities that do services that are not DDA funded. So I would say definitely reach out to your CCS. They'd be able to work with you.
Okay. We have a clarification question. Mm-hmm. If someone turns 21 after school starts, such as September 15th, okay, do they have to wait until the following year to obtain services?
From DDA, yes. So I'll say it again. So like, let's say somebody has a birthday of September 15th. We all know school normally starts that last week of August or somewhere early September, it kind of changes. If they qualify to go to school for that next year, we're going to look at them being a TY22. So I know that you have every right if they came out in June of this year, but we look at that birthday and say, oh, they were eligible to stay in school for another year. You're going to have to wait that year to go into services.
Does my child need to have a guardian to be eligible for services?
No, they do not. Nope.
It's an easy one. There are a couple of questions or a couple of chats that are in Spanish that I unfortunately won't be able to ask. Next question. How are CCS coordinating service providers evaluated? Are there customer service reviews on quality of service?
Just one more time. You said, how are CCS?
How are CCS providers evaluated?
Okay.
Are there customer service reviews on quality of service?
Okay. So what generally happens is DDA puts out an RFP for the agencies. That's what happened. That's how we got the 7. And they had their own qualifications. I can't tell you all of them, but they had their own stuff that they had to hit to be able to accept the contract. As of right now, every regional office has a CCS director. Ours is Carol Bowman. If you are having issues with your CCS or you're having issues with the CCS agency, please note that, yes, we would like that information at DDA, because that is how, we either rework contracts or relook at stuff or have meetings and things with the CCS agency. So please note that if you are having issues with them, definitely reach out to us. But as far as every little thing they were kind of what headquarters looked at, I don't know each little thing that they looked at when the RFP was out, because some of these CCS agencies have been with us for years. So I'm not sure of every little thing that they had to check, but we do look at customer service and we do listen to what the families are saying about CCS and whether they're not returning calls or whether they're, hey, I can't get anybody to call me back, or they don't seem to kind of know this process or anything like that. We have to know that stuff so that we can address that with the CCS agency.
Right. All right. I have the translated question. We sent the application to DDA, and as of today, we haven't heard anything or received a response. So how soon after submitting an application for DDA services should someone expect to hear something?
Okay. So pre-pandemic, normally when we got your application, we assigned it for a CA 7 days later. Problem is now, depending on how we get the application, like if you mailed it in or you faxed it, we're not actually allowed to be in our office. So we have admins going in certain days. So that can provide some time of maybe somebody's not there to grab it every day like we used to be. If you emailed it, generally we'll get that scanned in, and in 7 days, we'll assign that for a comprehensive assessment. And then from the 7 days that we assign it to one of the CCS agencies, they have 5 days to actually contact you to set that up. If it's been longer than that, you are then somebody that I would like for you to email me so that I can look into that for you. If it's been longer than like 2 weeks, please let me know.
Okay. Then there's a question about future sessions for the webinar. So I'm going to let Melissa or Karen answer those if they haven't already. Next question, we have an 18-year-old who requires 24-hour supervision. We are older parents. What is the process for determining need and securing help for residential services?
So the process for that, your CCS is going to meet with you. And I understand, like you stated, you were older. We're going to look at the needs of that person, what needs to be done, and what the family is able to do. And then our program team will make that determination. So if, you know, the family, sometimes they have health issues and like, hey, this person needs to be lifted up or they need to be bathed. And, you know, I've got this bad back or I can't bend and do anything like that. We take all that medical documentation and stuff into consideration. And then we'll make a determination from there. But it does happen. It's something that's actually very common.
Okay. Next question. My daughter is currently in the Community Pathways waiver. She's 14 and in school. Is she going to get booted out in her transition year of the Community Pathways waiver?
Oh, no. No. So before, we always had the Community Pathways waiver. And I think the other two, if I'm not mistaken, 2 years ago, we added the other 2 waivers. If you are already in that, we're not moving you or shifting you. But again, I want people to know that just because all the services can be offered in all of them, even if you're someone who's in the CSW and then you eventually need residential, we're just going to move you to the Community Pathways waiver. So I don't want everybody to think that, oh, I need to get a Community Pathways waiver now because what if they ever need residential? That's fine. We switch people from CSW to the Community Pathways waiver all the time. Do not be concerned about the waivers. We will make sure you get to where you have to go based off your need. So please do not concern or worry yourself about the waivers. We'll make sure that that you get everything that you need.
All right. The next question, at graduation, we were told services weren't needed, so we never applied. Now at age 28, she is in crisis resolution mode. What do we do?
So if you have a CCS, I would say reach out to your CCS because your CCS can write that up and determine. Remember, crisis resolution is someone who is being abused, someone who is or abusing someone who's being neglected or on the verge of homelessness. That's what we're looking for crisis resolution. So reach out to your CCS, and your CCS, like I said, can write that stuff up and submit that to our office, and we will make the determination. Your CCS is also going to be able to tell you based off. That's why I can't get documentation, because based off whatever you need the need and increase for, your CCS will be able to tell you what documentation completes that.
It looks like we have another question about somebody on the Community Pathways waiver living at home, and just making sure that the person stays in that waiver and wouldn't get booted out.
So. We're not booting anybody out of the waivers that they're already in.
Okay, let's see. I'm currently employed to provide personal supports to my young adult child who can help with EVV issues and guidance.
Please reach out to your provider. No, wait, to the EVV. So,
Yeah,
but I'll take that back. Wait, if you're having an EVV issue, like with you being the staff, if you're having an EVV issue, like with the machinery, something, that's going to be your provider. But if you have questions about it or why, then you need to reach out to your CCS. Okay, so I just want to make sure that's clear. So it's like the hardware of the system. I know that there's a whole new system that they have to do. The provider runs that, not DDA. But if it's a question as far as how it works or why it's happening, then you need to reach out to your CCS. I think, yeah.
Yeah, that sounds right to me.
Yeah. And I had to make sure, because I was like, I'm wondering, I want to know which part of EVV is she having an issue with. Like, is it the actual hardware in the house, the calling in or something, or like why it's happening? So like, yeah, if you're having an issue, like Technical issues, contact the provider. If you have any other questions about it, contact your CCS. That's what I'm trying to say.
Another question about the CCS. What is the CCS expected to do besides call and check up and ensure the DDA required paperwork is completed?
So a CCS, before you get into services, at a minimum, they are supposed to be checking in with you yearly. If it's your transition year though, so there's some people who are on the waiting list, like with a CCS 18, 19, maybe they're checking with you yearly, make sure everything's going okay. During your transition year, like let's say this is your last year of school, you're going to start hearing from them. You're going to hear from them a lot more because they're following up with you about providers. They're following up about all that other stuff to make sure the paperwork gets done. Then once you get into services and you start, your CCS will be following up with your loved one, you and the provider quarterly to make sure that everything's going as planned. Think of your CCS as the eyes and ears of DDA. There aren't a lot of us out there, so we can't see everybody, but they have their hands on everybody to make sure that everything's going correctly. Their job is to make sure that, one, your loved one's satisfied with services. Two, the services that DDA is paying for, we're actually out there, the CCS is going to make sure that the provider is actually rendering those services and not just billing us, and your loved one's just sitting at home. So we're also out there to make sure everything that we put in that plan, the CCS is going to make sure everything that's put in that plan is actually happening with your loved one. So like I said, the CCS is there as, like, I like to think of them as DDA's eyes and ears, but they're there to make sure everything is in compliance and going the way it's supposed to.
Okay. I just wanted to jump back to that EVV questions because there was a little bit of a clarification here.
Oh, okay.
Where she states that neither the CCS or the provider have been able to help with the EVV issue. So is there someone at the regional office who may be able to be reached out to about that? Or
can you email me, whoever this is, email me your question and tell me exactly in the email what the issue is, and I can get you to where you need to go. Great. Yeah, just let me know what the issue is.
Perfect. And then maybe Karen or Melissa can add your email to the chat just in case people don't have it, since your slide was taken down. All right, next question. Could you please clarify how the timeline of transition year works for a person whose birthday is in April and he is 20 years old, finishing high school now?
So if he's 20 years old and finishing high school now, if the birthday is in April, that means you just turned 20 in April. That's what I'm going to go with. That means that you qualify, because you're not 21 yet. You're going to qualify to go to school next year. Even though you're graduating, you're still going to qualify. So that means that for a year, DDA we're not going to provide those services. If someone turned 20 this year, they are technically what we consider a TY22, someone who's going to graduate in 2022. You're going to start, like everybody else in the summer, we're going to start reaching out to providers to see who you want to pick. In the fall, you're going to turn in those choices to your CCS. Your CCS is going to follow with the provider. Please note, though, that because he's coming out in June, July, August, September, October, November, December, January, there are no services coming from DDA. You can definitely look into doors or something like that, but those services aren't coming from DDA. So you're going to follow that timeline just like anybody else who's coming out in 22 would. So in the fall, like I said, you're going to submit your choice letter to your CCS. February, March, the CCS is going to come out or work with you via Zoom. And who knows where we're going to be at that point in time to enroll in the waiver. And then July 1 of 2022 would be the earliest that they will be able to start services. So, yeah.
All right. Next question. Somebody says, I thought waiver funding was only good for 1 year. Is that not true?
So waiver funding is, I think what you're thinking about is your time to get into the waiver. So what I'm saying is, like, the people that are graduating this year in June of 2021, they have a year to get into services. So that means they have until June of 2022 to get into services. Once you're in DDA services, once you're in our services, as long as you remain Medicaid eligible, you are good. I don't want you guys to think that, oh, well, how long are these services for? These services, as long as you remain Medicaid eligible, these services are good for life. So that means Medicaid, you cannot have any assets or anything over $2,000. I'm not going to completely get into it, but that's when we start looking at special needs trust, because as you guys get older, you might be leaving your loved ones money and things like that. They need to remain Medicaid eligible for these services though. So nothing over $2,000 in assets for the person in their name. So yes, that's how, but yeah, so the waiver services are good. It's just that they have a year to get into services. If you don't, then you go back on the waiting list. And as of right now, you can either be a TY to get in or be in crisis. So it is very important to hit that window for services.
Right. And now there's a question specifically about crisis resolution. You can also have crisis resolution if you are a danger to yourself or others, right?
If you are, if you're a danger to yourself, so someone who's being abused or abusing other people, or if it's a problem where the family is unable to get control of that situation in the home and we have a lot of issues, yes, that could be a crisis resolution situation as well.
Okay. I want to go back to the 28-year-old who is currently in crisis, but never applied for DDA. They are asking, what do they do and how do you apply for DDA at age 28?
You can still submit an application. So what you want to do is you want to submit an application to us, because the first thing is going to be, we got to see if you even meet the criteria. When the person comes out to do, or not come out, or calls you to do that comprehensive assessment, that is where you want to let them know what's happening. Because not only when they do the comprehensive assessment, not only are they trying to make a recommendation to DDA to say whether you're DD or not, they're also gonna make a recommendation to put you in a category. Again, your CCS can make the recommendation all day, but our eligibility team is gonna actually make that determination because we're gonna follow COMAR regs. So please, still, you can apply. And if there's a situation going on that is a crisis in the home right now, you just need to put all of that in the comprehensive assessment. And if you meet the crisis category, even off that application, we can make you DD and put you in the crisis resolution category and see if we can get some supports in the home. So yes, right. But again, you just have to meet the criteria.
Okay. Another person is confused about the difference between the priority categories and the waivers funding. If the child qualifies for a waiver, the waivers are currently funded after the child turns 21, correct?
No, not necessarily. So you said that you were confused by the priority categories. So everybody who applies to DDA goes on our waiting list. So these are people who are not waiting for service. Let's think of everybody who's waiting for services. You're on a waiting list. All of those people who are on our waiting list right now are in one of those three categories. Okay. That's how we pull for funding for the waiver. So even the TYs, even though they're in that current request category, when it comes time for them to go into the waiver, that's their eligibility year. That's kind of how we push that funding. So it's kind of two separate things. Everybody who's on the waiting list is in a category, and then you have people who are getting called for services. Right now, we're calling TYs. They meet a special group, and we're calling people who are in crisis. I hope that I answered your question. Rob, can you read the last part of that question though for me again?
Sure. The waivers are currently funded after the child turns 21, correct?
Okay. So right now, I will say yes. So not after they turn 21, it's kind of when their eligibility school year is up. Why I don't say yes, that's how it's done, is because 2 years ago when we introduced those two new waivers, we had to fill those slots. So we were just grabbing people off the waiting list and then we filled those slots. So now that they're full, we're back to either you got to be a TY or a crisis. But I don't want to say that that's the only way to get into services, because who knows what other funding may be coming down the pipe to fund other slots for the waiver categories. So yeah, but as of right now, they're funded for TYs and people who are in crisis as of today.
Someone asked what EVV is, and EVV is just electronic visit verification, and it's a regulation to ensure that people are actually seen. So there's a lot of intricacies to it, but it's basically just a way to make sure that people are seen and services are provided to them. That's probably the easiest way to sum it up.
Yes.
When, in your experience, is it time for an adult child with DDA services to move into a residential program, especially when parents age and there is no family member who can take care of them?
So as the parents age, and I do understand, we have to show that there is a need there. So as a parent is aging, I would assume that you're probably saying, hey, there are some things that are happening that we're unable to provide for him in the house. So what you have to show is that there is a health or safety crisis in that home where they cannot stay there. I'm going to be real honest with you. And I know we get a lot of parents like, well, we're aging and it's time for them to move out. That is not an assessed need. We would love to put, I mean, we just don't have the funding to put everybody in residential. The people who are in residential are normally, behavior risks or families or caregivers have passed away. So there is no one else. It's things of that nature to go into residential. Another option though is if you were to, we've had families also either get an apartment. We've had families work together like, hey, let's get our kids an apartment. If they were to pay the rent, I could put the support staff in there. We don't actually pay the rent, but if they were to get their own place, we could put the support staff in there to make sure that they are maintained and everything goes, they go on functioning day by day. But as far as residential services, we need to show that the person is in immediate danger or a health or safety crisis if they stay in the place where they're at.
Okay. I got a two-part question here.
Okay.
Number one, is DDA income-based?
No. So I would say no and yes. It is not based off the family's income. It is based on when you get on a waiver, it allows us to only look at the person in the waiver that's going on the waiver. So as I said, your loved one, your family members, they have to be Medicaid eligible, which means if you have a loved one and let's say they're getting Social Security and you guys have just been putting the money in an account for them, when it goes time to get on the waiver and we see that there's like $10,000 in their account, yeah, you're not going to make it on the waiver. So it's not the income based off the family, it's based off the person. They need to be, I keep stressing it, Medicaid eligible, no more than $2,000 in assets. And I know sometimes families are just like, well, they live here, we didn't need the money. That's fine. You can't just let it keep stacking up because then it shows that, oh, they have more money and they have this, so they won't qualify for Medicaid. So technically it's income based for the person, but not for the family.
And what is the DDA website to apply?
So it's actually, if you go on the DDA website, you just have to print the application. You can't apply actually online. I do apologize. So you'd actually have to print it. Melissa or Karen, can you guys put the DDA website in the chat? So if you guys just wanted to go to the website.
She's already put it up there.
Oh, okay,
one step
thanks.
ahead of you, Nicole.
It's in there. So yeah, just go to the website. And it has DDA application. It's in Spanish as well if you need it in English or Spanish. Once you fill it out, it tells you right on the back page of that application where to send it. I think it has the email address, the fax number, or if you want to send it regular mail, that's all right there.
Okay. One person asks, if my daughter becomes ineligible for SSI, then she loses Medicaid and she becomes ineligible for DDA services. Is that correct?
So if she becomes ineligible for SSI, we would look at, we would have to look at why she became ineligible for SSI. She was already getting it before. Normally I will say this, I have not seen where if someone has lost their Medicaid, DDA is automatically just like, well, we're not doing services anymore. We're not just going to leave anybody out there like that, but we're going to work to figure out what the issue is. Because normally, like once you have Medicaid, if you remain Medicaid eligible, that you shouldn't have an issue. Even there has been some people that have lost their SSI, but they still remain eligible for Medicaid. So we'd work the CCS and stuff. We'd work with you through that situation and see where the outcome will land. But we're not just gonna. Please don't think we're just gonna stop services and like just boot them out of services.
Another question we have here is, if somebody is in crisis prevention and things get worse and then they get moved into crisis resolution and then they get services, do you lose the DDA funding when the immediate crisis is resolved?
No, once you are in services, as long as, like I said, you remain Medicaid eligible and you are obtaining you're like maintaining and getting the service, then no, then you're fine.
All right. And then if we set up our son in an apartment and he requires 24/7 care, can DDA provide that level of support?
I will say, for people who are living in their own apartment for 24/7 care, we're going to probably, everything is on a case-by-case basis. I will say that. That's not generally something that that we do, because if someone needs 24/7 care and they're not able to be at home, so I'm wondering, are they not able to be at home because the parents are just like, no, we'll set you up in your own apartment? Normally, someone who needs 24/7 care and can't be at home needs residential services. Most of the time when people are in their own place, DDA, we can do like the daytime stuff, but it's like that overnight stuff. Are they able to, that's where things get a little tricky with us providing like awake overnights for people in their home, in their own house. But I will say this, it is a case-by-case basis. So it have to be written up and the team would have to look at it and see if there's an assessed need for it.
And maybe would supported living fall into that category? It's a fairly new service.
Yeah, it is. It's a fairly new service. So, and I haven't seen all the like the way it's going to work yet, but possibly. But I would say definitely reach out to your CCS, because supported living, that would probably be something your CCS can look at that with you as well. So if you have a CCS, remember, tell your CCS to look up supported living for you.
What about these COVID relief checks that keep coming? Does that money need to be spent eventually? Does that money need to be spent eventually to keep Medicaid eligibility? So far, it seems like they're ignoring it. And I don't know if you actually know the answer to this question. My understanding is that you have a year to spend that money down before it gets counted as an asset. So it doesn't get counted as an asset until that year timeline goes. That's my understanding of it.
Okay.
So,
you have a better understanding than I do of that.
Okay. When should we ask for a behavioral assessment? Would hitting, swearing, slamming doors, and putting holes in a wall count?
Yes. And so if you're someone who is already, like if you're already in services and you're seeing this happen, work with your CCS and request that through the PCP. And that documentation of that is what's going to go in the PCP. Yep, of what's happening.
Okay. Well, that's it. That was the last question. So I want to thank you so much, Nicole, for taking some time again to present to everybody, and to provide such a wealth of information about DDA services. You know it all. I tell you all the time how impressed I am with these webinars you do. For everybody else, there is a short survey with a link in the chat box. Please complete that survey for us so you can tell us how we're doing. We've also got our contact information, transitioningsuccess@gmail.com. If you have some general transition questions, our Facebook page is also listed there. And so please, feel free to reach out to us. We'll try to help as much as we can. And thank you all so much for joining us this evening. We hope we were able to answer your questions and help you out on this very confusing path that you're on. But we're here to help you. So thank you all very, very much. Take care and be well.